You recall that the governor asked of President Trump for a major disaster declaration for Louisiana, and as of last evening, the president granted that request. Joining us on the line is Governor John Bel Edwards. Governor, welcome to the show.
Well, thank you, Newell. It's good to be with you and your listeners, and you're right, and I appreciate the fact that the president signed our request. That makes us the fourth state to receive a major federal disaster declaration, along with New York, California, and Washington. And what that should do is put us in the conversation with those other states as being those most adversely impacted by this on a per capita basis. We still have the third highest case count in the country in terms of our population, on a per capita basis, and that's very significant, and that underscores the importance of the mitigation measures that we put into place and the need to have people comply with those, because quite frankly, we haven't yet seen the spread curve start to flatten in a way that's going to help us. If we stay on the trajectory we're on now, we know that we will, even after surging our hospital capacity, sometime around April the 7th or so, we will exceed our capacity to deliver health care in the Region 1, which is the New Orleans area. And we're doing everything we can in the meantime to surge that medical capacity. But the main message I have for your listeners today is to please take these mitigation measures seriously. Don't engage in any unnecessary travel, no contact that's unnecessary with people. Maintain your social distancing, because it is imperative that we start to flatten the curve. And typically, someone develops symptoms and tests positive perhaps 2 weeks after they caught the virus. So what we should see, if our mitigation measures are being helpful, is we should start to see the case count flatten. That hasn't yet happened, Newell. But I do want to thank our congressional delegation, Congressman Scalise. I know that Senator Kennedy made a call to the White House last night to highlight the importance of that major federal disaster declaration. So I appreciate the president for signing it, and I appreciate our congressional delegation for urging him to do so.
Governor, one of the things that you were asking for was assistance from the military. Those three other states that you talk about, I think they're on their way, New York in particular, with military field hospital operations. There was an interesting article in the Wall Street Journal that talked about one of the reasons that South Korea and both in Wuhan that they had successes is that they were able to set up temporary quarantine centers to try and move those that have tested positive and were infectious out of the mainstream of commerce, so to speak, and without any public interaction. Is that one of the things of the overall comprehensive strategy that y'all are looking at?
Well, it is. And so where South Korea did an exceptionally good job is very quickly after the outbreak in South Korea, they were able to engage in testing at a very high throughput level, meaning that they were collecting specimens to be tested with tremendous capacity, and then getting labs online to do the testing with a lot of throughput. And then they identified very quickly those people who had the disease, a big percentage of them anyway, and then through direct orders to them and contact tracing, they were able to isolate them. Well, the simple fact of the matter is our testing system is very robust today, but it was slow developing, not just here in Louisiana, but across the country. And so we didn't identify as many people early on, which is why the mitigation measures are so important, that people, if to the maximum extent possible, should be isolating themselves, not going out into the public unnecessarily. And we're trying to use that as a proxy for the robust testing early. And the other reason this is really important, we learned recently, because this is a novel coronavirus and we're learning more about it every day, is that during the early portion of someone's infection is when they are most infectious. And so you're shedding virus at a much greater rate early on in the period of time that you have it. Towards the end of your symptomatic period, you actually are greatly reduced in the amount of virus that you're shedding. So early detection and isolation, quarantine is the key, and so we're the United States, quite frankly, was behind on this, and so we're trying to use these mitigation measures as a way to catch up. But this is all very difficult. This is unlike other disasters that you and I are well versed in, and in fact, the entire state has a lot of experience in other types of disasters, natural disasters. This is very different. There's not really a playbook. We're doing the best we can, and I want to thank the people because we have had an awful lot of compliance. At the same time, I'm asking them to do more and to do better about complying with these stay-at-home measures. It really is stay at home, stop the spread, and save lives. And Newell, I have some information for you because, as you know, we update every day at noon with the new case count. Right. And I have the numbers that are going to come out at noon, and they're not available to the public yet, but I wanted to make them available on this show if you think that that's helpful.
Absolutely. Please deliver them.
Okay, so today we are showing 407 new positive cases around the state. And just to compare that, yesterday there was plus 216. The day before was plus 335. So if this is any indication, we are not yet flattening the curve, and that's the most disturbing thing about that. So we're going to show a growth of 407 positive cases since yesterday, a total of 1,795 cases across the state. The number of deaths, unfortunately and very sadly, jumped to 65 from 46 that we were reporting yesterday. And as to illustrate the point I made earlier about testing ramping up, we now have 11,451 tests that have been administered in the state of Louisiana and actually tested at labs. And those results are the ones that are informing the data that I previously shared with you. That's a plus of almost 3,000 tests in one day, because yesterday we were at 8,603 tests. So we now have the COVID-19, which is the disease caused by the virus, present in 48 of our 64 parishes. Of the 1,795 cases around the state, about 1,300 or so are in the greater New Orleans area, with 827 being in New Orleans, 359 in Jefferson, 67 up in St. Tammany, 23 in St. Bernard. So this is a very serious situation. We haven't flattened the curve yet, and we really need people to comply with these mitigation measures because we're on a trajectory right now, as I mentioned earlier, that by April the 7th or so, we're going to be in dire straits when it comes to administering health care to the people who need it the most. And we also have a ventilator capacity that actually could be overwhelmed a couple of days ahead of that. Now we are having some limited success in bringing in new ventilators. We are going to be distributing 100 today. I think we may have another 100 later this week to distribute, but we really need at least 1,000 new ventilators before April the 3rd or 4th, so somewhere in there. So I'm just giving the facts as best we know them. Much of this is based on modeling. Each day as we get new data, the models get refined and they change just a little bit. But right now, they're not going to change much because our trajectory hasn't changed.
Governor, one of the questions that we get a lot, both on the text line and call in, is when you refer to the 11,451 tests, is that the state lab or does that include the third-party labs as well?
No, that includes the third-party labs. So at one time, it was only the state lab that was testing, and we were primarily testing people who were in the hospital and symptomatic, and so we had a very high percentage of those individuals who were positive who were in the hospitals. Right now, I can tell you that of the overall tests, which were 11,451, 9,414 of those are private labs, and 2,037 of those are state labs. So the private labs are actually informing our data in much bigger numbers than the state labs, and as a result, the percentage of people who are tested that are positive is way down from where it was previously, and the percentage of people who are positive and in the hospital is going down, but it's somewhere around 20% as best we can gather right now. We need that to go to the 12 or 13% range, which is where it is in most of the country, in order to extend out the medical capacity that we have for as long as possible. But no, we're greatly ramping up these private labs that are coming online. In fact, we have some more testing coming online around the state today, and so this number is just going to continue to increase. But I'll summarize the data this way. There's nothing in today's report that suggests that our trajectory is changing. It is more of the same, and that is very disconcerting to me.
Well, it's more of an affirmation, quite frankly, that there's still the worst to come, right?
Yes, and you know, unless and until the curve flattens, then we have no reasonable expectation that this isn't going to manifest itself in a very bad situation. And I don't say that to incite fear or to cause people to become hysteric. This is just the information as best we have it. Now, I do want people to be determined and focused and resolute. I want them to be compliant because while the average citizen can't do anything to help us surge our medical capacity, they can help us reduce the demand on the capacity that we have. And that is by not engaging in unnecessary travel and contact with the public. You know, you can still go to the grocery store, but you don't have to go every day. Make yourself a good list and go once a week. And take advantage of the telehealth opportunities you have if you need health care. Try very hard not to go in to a doctor's office. It's all of those sorts of things that we can do that are outlined in the proclamations that I've issued that would really help us flatten the curve. And there is nowhere that it needs to be flattened more than in your primary listening audience around the greater New Orleans area. That remains the hot spot. However, I can tell you in northwest Louisiana, Caddo Parish has jumped to 93 positive cases today. Bossier Parish next door at 25. And so if you just remember, it wasn't that long ago. We were talking about 93 cases in New Orleans and 25 in Jefferson, and you see where they are today.
Absolutely. Governor, everyone's waiting with much anticipation for the signing of the relief bill, and both in dealing with this public health and economic crisis. The burn rate of state and local resources have been significant. How confident are you that they're going to be able to get these dollars down here in short order?
I'm actually feeling pretty good about it. I've talked to a number of members of the congressional delegation. They're giving us a heads up as to what's in the bill. And, of course, until it actually passes the Senate and then the House, it's subject to being changed. But there are provisions in there that will be helpful to the state in terms of state relief funds because we are burning through our cash as we respond to this. There will be funding helpful to the hospitals. There's going to be funding to help with our unemployment compensation and at least over the next 4 months, where there will be a monthly benefit for people who are unemployed in addition to their current weekly benefit, which is a standard amount. And I believe, very importantly, there's going to be a lot of relief for small businesses through the Small Business Administration in terms of loans, some of which may be forgivable. And these loans may be available to individuals who work, but they're not employees. Maybe they're a 1099 independent contractor, for example. So it's a little premature until the bill actually works its way through both houses of Congress and gets signed by the president. But it appears that all of that's going to happen over the next 24 hours or so. And then we anticipate that the relief will be available to the state pretty quickly thereafter, and I'll tell you, it's going to be absolutely essential. This is a very difficult situation, and it's primarily a healthcare emergency, and that's what we're treating it as, but it's obviously having an adverse impact on our economy, on our businesses, and on our employees. So the sooner we can come through this, the better. I do want to share with people my belief is that we can't ratchet down these mitigation measures until the facts suggest that we can and should, because there is no economic revival while hospitals are overwhelmed and people can't receive the care that they need. We're not all of a sudden going to be able to turn the spigots back on and get people to visiting New Orleans, for example, as tourists, or investing again in business so long as this healthcare emergency continues unabated. We have to work our way through this. We have to slow the spread. We have to get the number of people needing care back within the amount of care that we're capable of rendering. And until we do that, there's not going to be much opportunity to really open up the economy. I want to do that as soon as possible, like everybody else, however. We had the fourth fastest growing economy in the country when this hit. So nobody wants us to get back open fully and get everything back in place more than I do. But this is going to be dictated by the facts on the ground and not by an artificial timeline. But again, if the way people can help is by complying with these mitigation measures and helping us to flatten the curve just as soon as possible.
Well, on behalf of the listening audience, I want to thank you for your credible leadership, your very deliberate and direct response, and access and transparency to information. I agree with you. Sometimes it sounds dire, but it is what it is, and it's not going to change. Those are the facts. And I think the listening audience really appreciate the fact that you share that with them, and most of them, for the most part, are mature enough to process that information and know what to do with it.
Well, yes, and I appreciate what the public's doing out there, and again, we don't want fear and hysteria, but we do want seriousness and resolve and determination and focus. And let's get through this. Let's be good neighbors to one another, and as always, let's lift one another up in prayer.
Absolutely. Thank you so much for joining us. Stay safe, my friend. Stay healthy.
Yes, sir. Okay.
All righty, that's Governor John Bel Edwards. We got to get to a break. We'll come back to the talk lines when we return. Stay with us, 260-1870, or text 870-870.
Wow, how things can change from one week to the next. Hey, hope everybody out there is staying healthy. I know everything is super crazy. We feel disoriented by the COVID-19 virus. It's more important than ever to stay connected and check in with your loved ones. That's why I'm so happy I've got T-Mobile. Listen, T-Mobile isn't just talking the talk. They're taking measures right now to make life easier for everyone by doing the right thing for their customers during this really critical time. For example, T-Mobile has ensured all current customers with data plans have access to unlimited smartphone data on their network for 2 months. We're all in this together. T-Mobile truly believes that. And while many T-Mobile stores are temporarily closed to help keep customers and employees healthy, they've still got you covered with any help you need. Just check out T-Mobile.com. You can see what stores are still open and how you can manage your account online. Stay safe out there. During congestion, customers using more than 50 gigs a month may notice reduced speeds prioritization, video typically at 480p, capable device required.